I know some of the EOC and the health department folks are kind of upset with the media. I appreciate, Mr. Shelton being here. I was just, ORMC, they're private, right? And they don't have to be here, but they're here as well. I was wondering why, we couldn't get someone, just to be around, so if Eddie, if you don't have the answers right away, if there's someone there who could kind of tell them to you or something.
Well, so Michael, the way the EOC was set up was that they were to use a PIO, Public Information Officer, and that was understood and accepted by you at that time. So it should be accepted to you by now. Just consider that I'm the PIO for this scenario.
Okay. So that's what it is now, that you'll be basically the new Public Information Officer for the health department and the county and the EOC.
During this pandemic, yes.
Okay. Yes. Yeah. So how would you, would it be the same that we should email you prior to these meetings to get certain information back in a timely manner?
Well, it'll certainly make me look smarter if you would.
Okay.
Eddie, we have PIO cell phone numbers. Can you share your cell phone number with us, please?
I certainly will.
Great. I'm ready.
Well, not on this forum.
How would we get that then?
I will have Mr. Trevor Tankersley send it to you. He's the moderator here, and I'll send it to him and have him send it out to you.
That works. Thank you.
Okay. And I guess my last one, is like, there has been, some struggle to get information out of the county. And I was wondering if anyone, in this setting with us today can speak on that. I know we all have lanes to stay in, and that's a term that's been used a lot, to stay in your own lane. But at this point, aren't those lanes starting to become a little interchangeable?
So I want to just mention one thing about the health department and the work that they're doing. I don't want the fact that there's been some communication glitches overshadow the fact of the hard work that they put in, and the extensive hours and the accumulating data and all the work that they're doing be overshadowed by a few communication glitches. And we are working on that, and we're working to get better on saving lives, which is the priority. But communication is very important, not just to the media and to the public, but with all the other entities involved here. So I'm welcome to entertain any issues that they're having as well. So we're here to correct them. We're here to work together with all the community as well as the media and the public.
Anything else, Mike?
Does anyone else want to speak on that?
I mean, I'll be happy to. I called Mr. Shelton after the meeting on Friday and told him, thanks for being here, that I know that Scott and Michael will never treat him like Big 12 coaches treat him on the sideline in an instant replay. So if he can handle them, he can definitely handle you two guys. But I think one thing that we all have in common is that we want to take good care of patients, and that's what our folks do all over this town. Any entity you're at in ODESSA, you're getting good health care provided to you. And I think that's what, I don't want to lose the importance of that. And I appreciate Mr. Shelton's comments on that. So good work. Okay.
And then I just have one more for Ed Shelton. I saw that on the county website that patient 55 had changed 3 times from Thursday to Friday. Before they were listed as a 4-month-old on Friday, they were listed as a 32-year-old and an 11-year-old, and that was just patient 55. Are the patient numbers, are those changing, or why is that?
Well, Michael, I haven't noticed that, but I'll reach out to the health department and find out, see if we can't get you an answer.
All right. Well, thank you. And, that's all I have. So.
All right, thanks, Mike. Looks like we've got Jared from Channel 2. Can you hear us? Do you want to submit any questions, Jared? Okay, if not, then we got Melissa. Can you hear us? Melissa from Channel 9. You want to ask any questions? Nope. Okay, we'll go to Mitch. Mitch, are you there?
Yeah, hey. I have one for Mr. Shelton. Kind of to piggyback off what Mike was asking you, you know, I wasn't here on Friday, but I watched the update, and even today, it seems like you're getting answers to questions in real time. So I'm curious, who are you corresponding during these pressers to get the information we're asking about?
Corresponding with the health department.
And I guess who in the health department is giving you this information?
I'm not sure. I can't see them, but I'm going through a text. The patient number 55 was a Midland resident initially, and so it was removed, and that number 55 was assigned to that 4-month-old.
Well, I guess like I know you're going through a text, but who are you texting specifically? And I guess why can't they also be on this call?
Mitch, I'm the public information officer for the health department. So I'm the one that's going to be on the call answering the questions.
Oh, I understand that. I just wondered if we have any specific.
They're saving lives at the health department. Say it again. I'm sorry.
Oh no, I mean I understand they're saving lives, but there's also part of public health department's duty is communication, and I'm just curious if we do have specific questions, if they should be on here or not. And if they're available and watching these Zoom calls, I don't understand why they aren't on these calls as well.
Well, it's a team effort, Mitch.
Okay. And I guess just this is a general question to everyone on the call, but you know, there are a lot of organizations involved in ODESSA and Ector County's response to the COVID-19. I guess who would you say is steering the ship right now?
I would say the CDC is steering the ship. It gives us all guidelines to go by. And I think from the beginning, we've had a commitment that we would follow the CDC recommendations to treat our patients. I mean, I would think that that's where it starts.
I guess my question is like on a local level, like, is there a specific, who, I guess like for the hospitals in the county, and even though they're not here, the city, like, I guess who would you say, what organization is like leading the response right now? Who is, you know, coordinating and kind of helping everyone stay organized and in communication with each other?
I would say that that's your 2 hospitals doing that.
Well, Mitch, like I said earlier, this is a team effort. You have all the leaders of the hospital and the city and the county all working together to handle this thing, following the CDC guidelines.
Oh, I understand. I understand. I was just curious, like, if it was the hospitals leading the way or if it would have been the county leading the way, because every team effort needs a good leader. And so that's where my question came from. But those are all my questions right now, Trevor. Thanks.
Okay. All right. Thanks, Mitch. Melissa, you're back. Do you have any questions?
Hey, sorry about that. Yes, well, you know, we were listening to Governor Abbott talk about getting the economy going again and trying to reopen some things, parks and retail in a limited way. And then, of course, the surgeries, which is huge for you guys. I'm just curious from the medical leaders, what do you see on our end? You know, he's talking about statewide, but from our perspective here, what are some positives coming up that we can speak about?
I can probably start on that if you like. 2 comments. I'll talk about positives as well as, you know, perceived negatives that we are seeing as we go through this process. So each day we're talking, but each week, if you look at our numbers from last week to this week, the week before that to the week before, the numbers have been doubling every week. So we're in the part of the curve where our curve is still on the rise. So this is a very regional issue right now, that our numbers are still on the rise. We have not flattened the curve yet. Dr. Davenport said this one of these last couple of days we were on the call. So we have to be very mindful of when we talk about reopening. So the president has talked about it, our governor has talked about it, but regional specific strategy is very important. So we are working hopefully closely with our city and county leadership, giving them our sort of medical opinion and helping them make the decisions on what's right for our city and our county.
I think one positive, Stacy and I visited about this earlier today, the elective surgeries, the governor did address that. There are some points in his decree that we are going to have to work through because there's some requirements from the government for hospitals to be able to open those up. And I know there's a lot of hospitals are waiting on some clarification on those steps you have to go through to be able to open those back up. And there's brought some more questions forward with that. One thing the doc talked about that I couldn't agree with more is working with our regional partners. You take a look to our neighbors to the north in Andrews, per capita, they've got more cases than what we're showing because they've got 19 in a town of 12,000 people. I mean, that kind of concerns us about what's going on in the region because the region relies on the 2 hospitals in ODESSA and our friends in Midland to pick some of those up. So I think that the region situation is something to pay close attention to as well.